with depression, there are two main treatment models available in general for depression. One is medical intervention, so medication, and one is talking therapies. And this includes essentially talking with a therapist. It could be group therapy, individual therapy, or family therapy. The most widely used and effective treatment for depression is antidepressant medication, according to some studies, although this is controversial because antidepressants have side effects. But it's worth noting. So let's go into that a bit deeper. What do antidepressants do and how do they work? So if you remember from our previous lesson, we talked about the serotonin hypothesis, and that essentially one of the causes of depression, or potential causes of depression, is an imbalance or lack of serotonin, a neurotransmitter within the brain. Antidepressants work by acting on serotonin systems in the brain. And this increases levels of serotonin in the brain and therefore reduces depressive symptoms. However, one of the key factors or things to bear in mind about antidepressant medications is that they take a while to come into effect and for symptoms to actually be reduced. So it can take weeks, it can take months for some people, it really varies. Another thing to bear in mind is that they don't work for everyone that suffers from depression, and they aren't specific. So they don't show more effectiveness, or they are not more effective for specific groups of people. A lot of people don't respond to medication from antidepressants. So all in all, they are effective for a lot of people, but not for everyone. And there are also side effects, which I mentioned before, so that's worth bearing in mind. And the alternative to the medication treatment option for depression is talking therapy. And talking therapy for depression tends to come in the form of CBT, or cognitive behavioral therapy. So you may have heard of cognitive behavioral therapy before. It's quite common. It is an evidence-based theory. It has high amounts of evidence to support it, and it's recommended by NICE, which is the National Institute for Care and Education, for depression treatment in both adults and adolescents, so young people. How effective is it? Well, evidence says it's pretty moderate. It's not great, but it's not bad. 60% recovery rate from following a course of CBT. And this was found in adults, not in young people, so bear that in mind. What happens in CBT? It's mostly cognitive therapy, so dealing with cognitions, thoughts, feelings, behaviours, and then there's the behavioural component. It focuses on the ways people think and act, and it helps them to overcome problematic emotions and behaviours and ultimately manage symptoms of depression. It addresses behaviours, what one says or does, physiologies, bodily states, so this could be feelings of tiredness, anxiety, etc., and emotional states that relate to cognitions, so your thoughts and your beliefs.